for their health plan for next year and coming face to face with some eye-popping price hikes. We are talking about people learning that their premiums will double, triple, and in some cases quadruple. I've heard from parents and small businesses owners who were told that their monthly payment would increase by $1,000 or more a month. And I know there are lots of families just now tuning into this issue as they get ready to shop for healthcare plans for next year. So here's a quick rundown for everyone who's wondering. What exactly is it Republicans are so determined to avoid talking about? Why is my premium going through the roof? What is happening? Window shopping for healthcare plans has already started in Washington State and across the country in many places. Families are logging on to the healthcare exchange to see massive price hikes, monthly premiums doubling and tripling and worse. Why is this happening? Well, simply put, Republicans have refused to stop it. Democrats have been calling all year for action on this. We tried to pass an extension while Republicans were shoveling tax breaks at billionaires when they passed their big ugly bill, but they voted it down 3 times. And Republican leaders have refused to even talk with us about this. So where can you learn more? Families in Washington State can go to wahealthplanfinder.org to see what their health plan options will cost for 2026. What can you do about this? Well, the most important thing families can do right now is speak up. Let's be clear. Republicans are sticking their heads as deep in the sand as they can manage, and they would literally rather shut down the government than talk about this. We have to make sure we are so loud they cannot ignore us, no matter how hard they try. And that is exactly why I am holding calls like this and lifting up stories on the ground about the massive price hikes families are facing. I'm going to try to use my megaphone to amplify the stories Republicans are so determined to ignore. From the stories here in Washington and even the stories of some of our Republican neighbors that they're trying to ignore in their own states. And now is a critical moment to make sure those voices are echoing loud and clear. Because, as I said, window shopping is open. And even more families are now seeing what this means for them and speaking out, demanding action. So first I will turn it over to Ingrid to share with us what's happening on the ground in Washington State. Ingrid, thank you so much.
Thank you, Senator Murray. I so appreciate your bold leadership on this issue and your just incredibly strong commitment to healthcare access and coverage for Washingtonians. So again, I'm Ingrid Ulrey. I'm the CEO of the Washington Health Benefit Exchange. And for the listeners and folks on this call to know, people who don't have health insurance through their employer or through a government program such as Medicare and Medicaid truly rely on our exchange marketplace in order to purchase coverage for themselves and their families. Since 2021, the enhanced ACA tax credits have been a lifeline for our customers, enabling them to keep up with rising premiums and stay covered. This year, as mentioned, we have approximately 220,000 Washingtonians who are benefiting from these ACA tax credits. And without them, our actuaries have predicted that up to 80,000 of our customers may experience price hikes so high that they will make a very difficult decision to just drop coverage. So right now, the folks in our market who we are most concerned about include those who are our middle income customers who earn approximately, a modest annual salary of $62,000 or more per individual or $85,000 per more for a couple, who will no longer receive any level of tax credit or support if Congress doesn't take action, and they will be the most affected. As mentioned, it's in this moment, as of Tuesday, actually, that many of our customers are seeing their prices for next year for the first time and experiencing that sticker shock that you mentioned, Senator. These customers who are most affected and are feeling it the most include many small business owners, gig workers, and individuals who are self-employed, as well as older adults who are 50 plus, but not yet on Medicare. We predict that many of these customers will experience increases of up to $5,000 per year, and for some, even the doubling and tripling that Senator Murray, that you called out. And it's at that level that becomes the breaking point. And people think about, I have my mortgage, I have my groceries, I have, all my essential expenses, and feel that they just can't hang on. I also want to share and emphasize that health insurance prices vary broadly based on variables such as age, income, and geography. And we've been working within our state authority to mitigate some of the steep premium increases coming from the federal policy change, as well as the danger that we may not see these tax credits continue in 26. So open enrollment, again, starts in just 8 days, November 1, on our website, WA Health Plan Finder. We encourage all existing customers and individuals newly seeking coverage to come into our market and see what is available. As of Tuesday, given the window shopping that was mentioned, we've seen twice as many people as usual come in and go and look at what the cost estimates of what things might look like for them next year. In addition, we've already sent out the renewal notices. People will be receiving those in the mail towards the end of next week, and they can come into their dashboards, current customers, on wahealthplanfinder.org starting tomorrow to see actual prices for them as an individual. So if and when Congress can come to an agreement to extend the tax credits, the exchange stands ready to pass on this relief to our customers. While this is not going to be as easy as flipping a switch, we will work with our partners, including the Office of the Insurance Commissioner and our carriers, to make the necessary changes in our system as soon as possible. The sooner that Congress acts, the sooner that Washingtonians will benefit. So Senator Murray, thank you again for the invitation to join you today.
Thank you, Ingrid. And we're going to hear from someone who will tell her story of how this impacts her. Annette, thank you so much for joining us.
Thank you so much, Senator Murray, for highlighting this and bringing attention to this, because I was shocked when I got an email on Tuesday of this week about my premiums and how they were going to increase. My husband and I are retired. He's already on Medicare, but I'm only 64. So I've got another year to go. And the estimate for our premiums was going to include a $400 a month increase. Yeah. That's close to $5,000 a year. On a fixed income, that is really, really going to hurt us. That's going to cut into our already very, very, very tight budget. One of the points I want to make is that this is not political. This is not about Republicans and Democrats. This is about a moral issue. This is about taking care of American citizens. I pay my taxes and I pay my premiums, and I do all the things that responsible citizens do. And this is a moral issue. This really crosses party lines. This is a really tight time of year coming up anyway. I just am in recovery from a pretty significant back surgery. So I have ongoing medical bills that I'm still dealing with. My husband has issues coming up that he's going to have to deal with in medical things. And so these are things we tried to plan ahead for, tried to think about ahead for, but we just could not imagine a $400 a month additional hit to our income. Gas prices are high, groceries are high, utilities are going to be even higher going into the winter. So, we try to be responsible. We try to be frugal. We don't go out to dinner, frankly. We don't buy new things. We have older vehicles. And this is really something that is going to hit us pretty hard. And not just us, but many, many, many other people. I've never done anything like this before. I've never spoken out publicly before, but I really just felt like not only for me, but for anyone else in this situation, it was just really important to tell my story and hopefully maybe the politicians across the aisle will be able to work things out and do what's right for the American people. Thank you.
Thank you, Nanette. I really appreciate your courage to come on and say what's happening to your family. It's happening to so many, and we need people to speak out and put pressure on Congress to fix this. So thank you.
Great, and we've now got time for some questions. So if you've got a question, please use a raise your hand feature and we'll call on folks in order. And I see we've got a question already from Dave. Dave?
Hey, good morning. Dave Furtado, Keeper Action News here. I just had a question. I have a few questions for the senator, but I'll start with this one. A lot of constituents, or there are constituents that are saying that the Democrats are the ones that are holding up the government shutdown, leading or continuing the government shutdown. If you will, even going so far as to say that you're holding the Americans hostage. Why are the Democrats the good guys in this situation?
What we have been very clear about is that we want the government to be open and we want to fix this tax credit issue. So we are asking our Republican colleagues to come and talk with us and work this out so that government can be reopened. I'm stunned. I've been in Congress a long time, and this is the first time Republicans have even refused to work with us. That's what we're fighting about. We're going to keep fighting until Republicans come to the table, work with us, and solve this for people like Nanette.
I'd like to ask a follow-up real quick because this is kind of goes right in line with it. Why is the onus on the Republicans to come and chat with you guys and come to the table for the negotiations?
Well, the answer is really simple. So what they're asking for Democratic votes on a continuing resolution, and they have to have them in order to pass. And we said, we are happy to give those to you when you allow us to have a conversation with you about how we fix this problem of people's healthcare tax credits.
But the Republicans are saying if you just sign the clean CR, they'll talk about this.
Oh my gosh. I'm going to answer that because I am really frustrated with that.
Yeah.
We have been telling Republicans since the last 6 months that these tax credits are going to expire, and we're going to hit this day in a week where people are going to see their healthcare premiums double, triple, and in some cases quadruple. And we have asked them to come to the table and work with us. That was when government was open. That was when they were passing the big, beautiful bill that extended tax credits for billionaires. And they would not be bothered with it. In fact, they voted it down 3 times. And so we said, okay, fine, we are here now. Come and talk with us, help this work us out. If you want Democratic votes, this is how you have to get them.
Is there anything the Republicans do, or is there any way that the Republican, or what is the way that the Democrats can really count on the Republicans' word that if you do sign the continuing CR or the clean CR, that they would actually negotiate on extending those tax credits?
Well, so that's part of the problem. They are saying to us, well, just open up the government and then we will. Well, why didn't you 2 months ago? Why didn't you 3 months ago? Because you didn't want to. So we are telling them now, here, this is what the deal is. We will open government when we fix the tax credits. And by the way, they won't even come and talk to us about it. So, it's really dishonest of them to say we'll do it later. They haven't done it before. They haven't done it a long time before. They haven't done it when government was open. They're not doing it now. It is a very simple solution. Have the leaders of the Republicans, president, they are the majority in the Senate, they are the majority in the House. Pick up the phone, call our leaders, sit down and work this out. That's what a democracy is about.
I have one last question. I'll get out of here, I promise. Senator Susan Collins from Maine has reportedly proposed a 6-point plan to open the government and even floated the idea of a bipartisan gang. As the vice chair of the Senate Appropriations Committee, what are your thoughts on that? And why hasn't that gained any traction?
Hasn't gained any traction for the same reason. Her proposal is, we'll do it later. We'll talk about it later. Later is too late. We are at the doorstep right now. Nanette got her notice in the mail. She knows what her insurance is going to go up. If we say, okay, fine, we'll deal with this by the end of the year, it will be too late to impact people's insurance costs for next year. This is a now issue, not a later issue, which is what they're calling for.
All righty. I appreciate you taking the time to answer my questions. Super front loaded. Thank you so much, Senator.
All right, and we've got time for questions from others. If anyone has a question, please raise your hand. And if you can't find the raise hand feature, feel free to just unmute and ask your question as well. give it just another moment here, and if there are no other questions, I will turn it back to Senator Murray to close us out.
Well, thank you again very much. The time is now. Contact your members of Congress. Say, get to work and solve this problem. We're here. I'm at the table. Democrats are at the table. We want to get this fixed so our constituents do not get hurt. Thank you.